10 OSCE tips that every student must know. Are you preparing for your NMC OSCE and you're feeling overwhelmed? Don't worry, I've got you covered. In this video, I will share 10 powerful OSCE tips that will make you stay calm, confident, and prepared for the exam. I'm Kenny. I simplify OSCE prep for a student like you. If you are new here, you might want to subscribe, like, and drop comments for weekly OSCE tips. Now, let's jump straight into tip number 1. First point is understanding OSCE structure. Students fails because they don't properly understand how OSCE stations works. Here are a few actionable advice for you. Number 1, study the exam format and the stations in advance. 2, know how much time you get for each station. 3, read the marking criteria, which is key. Second tip is master the basics. Yeah, this is imperative. Do not try to memorize everything. Focus on the core skills first. Here are what to prioritize. 1, history taking techniques. Secondly, clinical examination skills. Thirdly, common procedures such as vital sign checks or administration of injections. Tip number 3, practice under timed condition. Timing is crucial in OSCE. You need to practice completing tasks within the given time. Here are some points to enable you practice effectively. First, set a timer and simulate real exam condition. Secondly, record yourself or practice with a partner. Fourth top tip, use a structured approach. A structured approach helps you to stay organized and avoiding missing important steps. Here are the example of useful framework. For wound assessments, you may want to adopt an acronym TIMES. And for planning, you may want to adopt IMATARID. The fifth point is you should stay calm under pressure. Examiners are not there to fail you. They want to see you handle pressure. They want to see how effective you can be even when you are tensed. Here are a few mindset tips. Before entering the station, take a deep breathing breath, as this will help you to allay any worries and to make you stay calm as much as possible. Secondly, if you make a mistake, correct it and move on. Important tip is you need to communicate clearly and confidently. Your communication skills matter as much as your clinical skills. Here are some key strategies to this. Avoid medical jargons as much as you can. Communicate in a layman term that the patient will understand. Do not try to form any accent. Communicate in your native languages, as this will help you to be yourself. Maintain eye contact and show empathy. Top tip number 7. Many students lose marks just because they don't pay keen attention to the instruction given in their scenarios. Here are what to do regarding this. First, take about 10 seconds to scan through your scenarios. This will give you a clearer insight on what to expect, on what it is expected of you by the examiners. Secondly, identify keywords such as demonstrate, assess, or explain. Tip number 8, practice active listening. Examiners love it when you practice active listening, especially in your history taking. Here are top tips on how you can improve. Nod, repeat, and summarize patient response. Ask open-ended questions such as, can you tell me more about that? Top tip number 9, revise using your marking criteria as well as the fire stations. Yes, as OSCE scenario are similar, although there may be slight variation. So going through your marking criteria is key. Here are top tips on how to find resourceful materials. Watch some of those OSCE clinical skills on my channel because I've got quite a few of them. Top tip number 10, which is the last but not the least, is you should give room for good critics. Get feedback and improve from whatever constructive criticism that may be coming. You cannot improve if you don't know what you are currently doing wrong. Here are some of the ways that you can get feedback. Number 1, ask your tutor or study partner for critiques. Record your practice section and analyze mistakes. In order for you to succeed in your OSCE exam, you need to put in mind all these tips that has been itemized in this video. Which of these 10 tips do you find most useful to you? Let me know right there in the comment section. If you want more OSCE tips like this, do subscribe, like, and drop a meaningful comment for us. You can as well check my channel for more useful tips for your OSCE preparation. Until I see you in my next video, keep practicing OSCE.